to you and welcome to Adelante Chicago. I'm Lourdes Duarte. Thank you so much for joining us today. Well, November is Lung Cancer Awareness Month, and the American Lung Association wants to remind us about the importance of screening, especially for the Latino community. Here's why. Look at these numbers. Latinos with lung cancer were 16% less likely to be diagnosed early, 30% more likely to not receive any treatment, and 9% less likely to survive 5 years compared to white Americans. Here to explain a little bit more about lung cancer and the impact it has on our community is Dr. Juanita Mora. Hello to you.
Hi, so great to be with you today, Lourdes.
Of course. I want you just to weigh in on these numbers that I just talked about.
Absolutely. It means we have a lot of work to do to bridge the health equity gap when it comes to lung cancer. Lourdes, when we're talking lung cancer, it's the #1 killer when it comes to cancers in the United States, period. And here we're going to have, in the state of Illinois, 238,000 new cases of lung cancers this year alone. It means that we want to catch them early, screen them well, and we want to make sure they follow through with treatment so that our 5-year survival rate also increases. So we want people of color especially to hear this message, because over the last year in our annual State of Lung Cancer report, we found an increase of 17% in people of color getting screened, and an increase of 17% as well too when it comes to the 5-year survival rate from lung cancer nationally. It's about 26.6%, but we want people to know, because only 4.5% of people eligible to get the CAT scan to detect lung cancer early have gotten the test. So only 4.5% is not enough, Lourdes.
Okay, so I want you to talk about, because you get to talk to people day in, day out who come into your office needing help. So I want you to tell us sort of why many of them are waiting to get screened, why they don't want to do it. What are you hearing from folks?
Well, some is, well, my insurance might not cover it, is a big deterrent. But when they did in our annual State of the Lung Cancer report, they looked at Medicaid, and in 49 states out of the 50, the CAT scan for detection of lung cancer is actually paid for completely by Medicaid services. So that should be an X, and we want to bring down that myth. The other one is, well, maybe I don't need to. I quit cigars or cigarettes more than 15 years ago. New recommendation: if you quit within the last 18 years, you are eligible to be screened and should be screened with a yearly CAT scan of the chest to detect early diagnosis of lung cancer. The other thing is, well, if my survival rate's going to be so low anyway, why get the CAT scan? If I'm going to die, I'm going to die. So I tell people, if we catch lung cancer in early stages, 5-year survival rate increases by 63%, Lourdes. So that's a huge number. And we want people, and then also surgical treatment. If we catch it already, there's surgical treatment that can be done, and now there's medications, chemotherapy, and radiation. So lots of things in the pipeline.
Yeah, it's a lot of things to think about that could change your numbers. You're right. You're absolutely right about that. I want you to talk about sort of how the pandemic played into all of this, because you would think after the pandemic, respiratory health and lung health would have become more important within many communities. Is that not the case within the Latino community?
Well, not the case when it comes to communities of color, because a lot of them felt mistrust because of what happened in the pandemic, Lourdes. So a lot of them really lost that trust with doctors and with the medical community. So now we're trying to get them back, because a lot of them have not resumed their normal physicals, Lourdes, their normal lab work, getting their heart checked, their cholesterol checked, and lung cancer screening is also part of just physical maintenance as well too, especially for people who were ex-smokers or exposed to secondhand smoke as well too. So this is why it's so important for people to get screened. And the other thing we found is during the pandemic, from 2015 to 2019, where this report comes from, less people got surgical treatment and less people sought also a diagnosis, and probably because the community centers were closed at that time. But now we're trying to get people back, Lourdes.
Okay. At what point do you think somebody would be a good candidate for some of this lung cancer screening? I know you mentioned if you were a former smoker, if you were exposed to secondhand smoke. Anything else?
So definitely, they can take a quiz on our website called at lung.org, or they can go lung.org saved by the scan, and it's honestly takes a minute, Lourdes, and then they can print it out and show their doctor that they're eligible for the CAT scan. So 20-pack your history of smoking is one of the actual requirements that can be used. So if they smoke for 5 years but were smoking four packs of cigarettes a day, they're eligible, or 20 years at 1 pack a day, that they're eligible. So any quantity that equals 20. Secondhand smoke exposure, radon exposure also qualifies them. And if they quit smoking within the last 18 years, Lourdes, these are all actual signals that they need a CAT scan to screen for lung cancer, because the earlier we detect, the more lives we can save, Lourdes.
All right, makes sense. Dr. Juanita Mora, you always have great advice and great numbers to share with us, so we appreciate your time.